The African Union's health watchdog has declared the growing Mpox outbreak on the continent a public health emergency. The African Centre for Disease Control and Prevention says at least 16 countries have been affected. Brenda Radido has more.
The Democratic Republic of the Congo is experiencing the biggest outbreak of viral Mpox ever recorded. And the outbreak of the new variant of Mpox known as Clade 1 has spared no one in this displacement camp. 7-year-old Grace Kabuo was the first confirmed case.
My daughter Grace had caught the skin lesion disease. I took her to the hospital where the doctors took good care of her and she recovered. And I don't know how or by whom my child had been contaminated. I just watched helplessly as the symptoms appeared on her body.
Isolation rooms that were used for the Ebola outbreak have been repurposed for children with lesions on their bodies.
What we fear is that when investigations are not carried out properly and there is no follow-up of contacts of confirmed cases, this is a major challenge for us. And we hope that, especially in the camps, we'll be able to organize contact follow-up with community relays and community leaders, as this is how we hope to break the chain of transmission.
Confined camp conditions are making it difficult to contain the disease. It spreads through contact with an infected person or animal. Symptoms of the virus include swollen lymph nodes, headache, fever and backache, making it harder to detect. An Mpox vaccine shortage has prompted the WHO to ask manufacturers to submit expression of interest for emergency use. And as the new viral strain spreads beyond DRC's borders, the WHO will meet on Wednesday to consider if it should be declared an international emergency. Brenda Radido, TRT World.
Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter's Medical School and joins us live now from Bath here in the UK. Thank you very much for your time, first of all. Just how concerning is this new variant of Mpox?
Well, the concern is that it is spreading rapidly in the African continent. And this is a close person-to-person spread of infection. And it just shows that we cannot just manage infectious diseases by ignoring it. The concerns are that if we've got a large number of people already exposed and infected, we expect more cases to emerge.
And you talk about how contagious it is. What can be done to prevent it from spreading further, Dr. Pankania? And has the Democratic Republic of Congo got the means to contain it? Because there is this shortage of vaccines we're hearing.
Indeed. So the route of transmission of Mpox is through close personal contact, which is in a way good news because it is not as infectious as, say, the SARS-CoV-2 virus was. However, the other things that they've also got to do is identify close contacts and keep them out of circulation. Now, with respect to the Democratic Republic in Congo, DCR, the issue is there is war, there is insurrection, there are problems of transport, there are problems of logistics, and of course, a shortage of the appropriate vaccines. Now, those vaccines are, not available in abundance in any case. So we've got to be very careful how and who we use these vaccines upon. And now it's not only the DCR, but it is in Rwanda, it's in Kenya, and it's in other surrounding countries as well. So it's much more than just the DCR.
You mentioned there it's much more than just the DCR. It has actually spread to 16 countries already, we're reporting. That seems an awful lot. However, and I know that it was a milder version of the virus, but it spread to more than 100 countries back in 2022. This variant, which isn't quite as mild, could we be talking about the spread to that many countries yet again here?
Easy is the shortest possible answer, and therefore primary prevention measures are very important. In other words, you identify people who may be exposed, and you remove them from circulation. Because as I used to say during the SARS-CoV-2 pandemic, what happens in Africa will happen in other parts of the world. So if it has, as you said correctly, spread to so many African countries, then other nations of the world also should be in a level of preparedness, because what is happening in Africa will definitely happen in other parts of the world.
Dr. Pankania, we really appreciate your time and for talking to us here at TRT Wealth. Thank you very much.
Thank you.